wanted to ask you a few questions about your experience here in Sheba.
Okay.
Let's start with how did you find out about this treatment here in Israel?
Okay.
And why did you go to Israel from all
Other
places?
countries.
Yeah.
Okay. So I would say that Sheba is a very popular name in most of the cancer hospitals in India. Like I was recommended by Rajiv Gandhi Cancer Institute in Delhi. And even from Tata Medical Center in Kolkata. I have also met several patients who have come from India, and they have also been referred from big hospitals of cancer treatment in India, like Medanta is there in Gurgaon, and I also found one patient coming from Chennai. So in India, the name of this hospital is well known, especially for the Kharti treatment.
It's your first time in Israel. I guess it's probably been very strange to arrive here and the visa or the whole from the time that you decided until you managed to come. Probably been a process, not easy process.
Process has definitely not been very easy, I would say. It has been more than anything, it has been time consuming to get the visa and all those documentations. Having said that, this is my first trip to Israel, and overall it was a decent experience. The sad part of it was perhaps I was told that I am COVID positive immediately on landing, and I was here on quarantine.
You've been a patient here and also in India before. How was your treatment in Sheba compared to India?
So in this I would like to say that in India, most of my treatments were done at Rajiv Gandhi Cancer Institute in New Delhi. They were chemotherapy treatments. And in Sheba, I have only undergone the CAR-T cell therapy and the treatment of CAR-T cell. And I think Dr. Victor, who is heading the department for lymphoma as well as for CAR-T program, he is a very knowledgeable person, and his team is very good, very efficient, and they are there for the patient always. They are very caring and very dedicated towards the patient. So they listen to the queries of the patient, and they try and help the patient out at most times. Personally, when I had arrived in Sheba, my disease was quite at a later stage. In fact, some people in Calcutta were also saying that is it too late to go so far? But coming here, I think the doctors treated me very well, and there weren't as such too many side effects.
Yes, you were lucky not to have side effects.
Yes,
that's good. So overall, if you will talk to other patients, will you recommend them to come to Israel and go through this difficult process of coming to Israel and spending here, 3 months almost? Yes.
So I would definitely recommend. 3 months is nothing compared to a lifetime of cure, and it is worth taking the risk, especially knowing that the doctors are really good here, and all the people who referred me here, they told me that it's a good place, you should go. So I would definitely recommend, and even my experience was very good, and I'm sure many people are trying already to come here, those who are having similar illnesses like me.
I was glad to be able to help you with your stay here. I know it's not easy. I'm sure very difficult to come from India and with this different mentality and different culture and food. Yes, we didn't talk about the food problem. And so yes, I hope I've been able to help with all those little aspects, I think, of the treatment that are not the treatment itself, but I think very important for the patient to feel comfortable, you know.
So about you, I would like to say a few words. I think the dedication and commitment towards your patients is very amazing. You have been there right from the beginning when I left my country, India, when I landed in Israel, all the time when I was in isolation due to the COVID positive. Then even when I was about to get hospitalized, we were there clearing the hospitalization formalities. And even after discharge from the hospital, all throughout you have been there. And you have completed several hospital processes for me, which I think were which would have been very difficult for me to complete otherwise. So I think that you have been very helpful as a person, and you have treated me that like someone who really needs help, really needs support, and very caring attitude, and your work ethics are very good. So, and in fact, I would say that if any patient wants to come from India, I would definitely give them your contact details.
Thank you. I hope you'll come to visit as a tourist again one day.
I will try. I will try.
And not to hospitals.
Definitely.
So now, what do you recommend? What do you want to add? And some tips for patients.
Okay. So, a couple of things I would like to make patients aware. That in the quotation that is shared initially from the hospital, it is mentioned that people are well conversant with the English language in the hospital. But I don't think that that's the case for quite a large number of people. So foreign tourists who don't know the local language will find this a bit of a struggle.
Like some of the nurses, or some of the nurses, you
In
mean?
fact, some of the nurses, in fact, some of the other hospital staff, counter staff who are there at the billing points, so they just say that no, we do not know the English language. So for a foreign tourist, it becomes a little difficult. Another thing which I would like to highlight is I believe that there are very few translators in the hospital now. A hospital which is this big, which is the top 10 hospitals in the world, I think the patients would also like to know their reports in the English language. The reports are generally generated in the Hebrew language, and they are shared with the doctors and the nurses concerned. But the patient would also want to know, and it requires a lot of follow-up.
Faster to get those
It requires
English
a lot of follow-up
reports.
to get the English report. I think these two, I would say, would help the patients far more. Patient experience would improve far more.
Okay.
So
Thank
that's
you.
about it. Yes. Thank you.
Thank you.